because of how COVID works, because it is what we call a virus, it doesn't we cannot treat it with antibiotics. And I know that we use antibiotics for a lot of things when we're feeling sick, but COVID is because it's a virus that antibiotics do not work. So we rely more on your body's own immune system and its defenses, and we try to help support that with different things. And so, for example, when you get sick with COVID, you can have a fever. So using Tylenol or ibuprofen can be helpful to make you feel better, to bring that fever down, and to help relieve the discomfort you have with COVID. Many people will feel congested, and they cough and they have all this stuff coming out of their nose, all this gunk. There are things like nasal saline sprays, which you can use, and it's basically salt water. And salt water is great for getting congestion out. So it can really make you feel better when you have all of that stuffiness. Stuffiness can cause you to have headaches. It can make you feel really tired. It just makes you feel crummy and uncomfortable. When you're having cough, there are medicines like Robitussin, which you can take to help relieve that cough. So a lot of what we're using are things that you can buy in the stores to help make you feel better while your body does the big lifting of fighting off the COVID infection with its immune system. There are people who do have trouble breathing sometimes. So we have people who feel like their chest is tight and they feel like they have a hard time taking a deep breath in. You may have heard of things like inhalers. So they have inhalers or sprays that can help open up the airways over the counter. But for many of the inhalers that really help with breathing, you have to get it as a prescription from your doctor. And that's where it gets a bit tricky outside of just using the at-home remedies to help make you feel better. So if you do have a doctor, it's great to call them and say, "Hey, this is how I'm feeling. My breathing is harder to take deep breaths in. I'm feeling more uncomfortable and sick. What can I do?" Many doctors will say, "Hey, come in. Let's take a listen to your lungs and just make sure that your lungs are okay when you breathe." And if they do find that you can get more benefit from a medicine, they can give you an inhaler, which helps open up your lungs. And your lungs, you can think of as like a big tree with a lot of branches, and those branches hold oxygen at the ends of the tree. So albuterol basically opens up the branches and makes the branches wider. That way you get more oxygen in every time you breathe. So that can be really helpful when you feel like you're struggling, you feel like you're tight. The inhaler will open up that space and you just feel more comfortable. So that's an example. Um, as far as additional medications go, there are a couple on the market right now, and you may have heard about some of these medicines. Remdesivir has been something that's been thrown around in the recent past. That's used for people in the hospital who are very sick from COVID, and it's used to help prevent them from getting sicker. Right now, we have a medicine. It's a pill, and the pill is called Paxlovid. And I don't know why they came up with these names. They're very unusual, but basically, it's a pill that you take for 5 days, or excuse me, 3 pills that you take for 5 days. And it's for anybody who is 12 years old and above who is at risk for very dangerous complications from COVID. So it's used to make you feel better if you have really mild or sort of moderate symptoms, as we like to call them. So those would be things like having a cough, runny nose, fevers, just feeling tired, like those kind of things. If you are having trouble breathing, or if you can't take a deep breath in, that's an emergency, and you should be seen by your doctor, or go to the emergency room for more quicker care. But if you have those other things like colds, like runny nose and fevers, Paxlovid can be helpful because it will keep COVID from getting worse and more dangerous, but it can also make you feel better a little faster as well too.